The connection between financial health, physical health, and mental health is strong. Financial stress and vulnerability takes a toll on the body and the mind, impacting appetite, blood pressure, and mood. What if there were free tools to help you identify patients who are financially vulnerable, to help you provide support and resources to protect not only their finances, but their physical and mental health? The good news? There are. Since 2014, a set of easy-to-use and robust tools focused specifically on financial decision-making have been researched, designed, and extensively tested to help you assess the financial health of your older adult patients. So what are these tools? They are 3 distinct interviews designed to assess an older adult's decision-making abilities and help determine whether they're at risk of being exploited or are able to continue making independent financial decisions. Additionally, the interviews allow you to have a better sense of your patient's financial decision-making capacity, which can be a first clue of a cognitive deficit or decline. They also can act as a baseline to help you know when an older adult's abilities are changing and may need additional support. The tools include an array of resources as next steps. These can help prevent exploitation in at-risk patients by referring them to financial coaching, training, or counseling. If exploitation has already occurred, programs are available to help file charges and protect and recover funds. At the heart of this effort is Dr. Peter Lichtenberg's desire to empower older adults with the information they need to advocate for themselves and be provided with trusted resources for support. The interviews come out of the work done by Dr. Lichtenberg, who is the director of the Institute of Gerontology at Wayne State University in Detroit, Michigan, one of the nation's preeminent public research institutions in an urban setting. Dr. Lichtenberg has also used his expertise to testify in dozens of cases involving financial exploitation. The tools are the result of many years of extensive research, published in peer-reviewed journals. They're backed by empirical data and tested in the real world by healthcare, financial, mental health, and other professionals, and their usage by professional organizations reinforces their credibility. These tools have been used with a large, diverse population of older adults and are well received, appreciated, and have identified and protected many at-risk individuals. Lastly, the tools are always being evaluated and refined through a continuous improvement process. The first interview is the Financial Vulnerability Survey, or FVS. The FVS is a 17-question survey that indicates the older adult's degree of vulnerability to financial exploitation. It was designed to be extremely easy to use in a wide range of patients. The FVS was created as a self-report, but can also be administered to the patient. The second interview is the Financial Decision Tracker, or FDT, which consists of 10 questions you ask the patient. These questions are designed to screen an older adult's financial decision-making capacity relative to a recent, specific, and significant financial decision or transaction. Exploring a specific financial decision allows you, the interviewer, to assess an older adult's informed financial decision-making abilities. The third tool asks a series of questions to a trusted relative or friend of an older adult to better understand one of the older adult's recent financial decisions. There are 2 options here. The first is the Family and Friends Questionnaire, or FFQ, which the family member or friend of the older adult can complete by themselves and thus save time. The alternative is the Family and Friends Interview, or FFI, which is administered by an interviewer. These questions examine both the psychological vulnerability around finances and the decision-making skills of an older adult, and are best used in combination with the FDT or FVS. Each tool is scored online. Resulting risk scores, appropriate next steps, and additional resources can be downloaded and put into a patient chart. Additionally, the interviews are supported by staff training and certification to support your efforts with your patients. We recommend using these interviews for patients aged 50 and up. A great starting point is to have a staff member administer the Financial Vulnerability Survey as part of the intake process to determine any risk of exploitation. If risk has been determined, then the Financial Decision Tracker can take a deeper dive into your patient's financial judgment, vulnerability, and decision-making. Free training is offered on the FDT. You care about the health and well-being of your patients. These free, easy-to-use tools can help you enhance the care you provide by identifying and supporting patients who are financially vulnerable. Good health is a combination of physical, mental, and financial well-being. Use these tools to add an important component to the quality healthcare services you work hard to provide.